Type 1 diabetes. Type 1 diabetes and exercise. People with type 1 diabetes benefit from exercise, but they need to take precautions to prevent sudden drops in blood glucose levels. Diabetics should check their blood sugars before exercising and may require eating a snack before or during exercise. They may need to adjust their insulin dosage before exercising to ensure they stay within normal ranges of blood glucose. People with type 1 diabetes may also need to check their urine for ketones. Ketones suggest that your blood sugar is too high. Strenuous activity needs to be avoided if ketones are detected or if your blood sugar level is either high or low before exercise. Type 1 diabetes and diet. A balanced, healthy homemade lunch for a person with diabetes. People with type 1 diabetes, like everyone else, need to eat a well-balanced diet. This will help their insulin therapy and reduce the chance of diabetic complications. There is no diabetes diet. Even a person with type 1 diabetes can eat sweets as long as it is part of a well-balanced diet. That is not to say they can eat anything all the time, but they need to consider how sweets can fit into their well-balanced diet. Type 1 diabetics should also consider the fact that carbohydrates raise blood sugar levels faster than any other food. Food low in carbs, but high in calcium, potassium, fiber, magnesium, and other vitamins are excellent food choices for diabetics. Consider the following guidelines when planning your meals. Eat less unhealthy fat. Get enough fiber. Keep track of carbohydrate consumption. Keep track of carbohydrates in sugar-free foods. Healthcare workers such as dietitians can help people with diabetes plan a well-balanced and varied diet. Type 1 diabetes and pregnancy. Women with type 1 diabetes need to let their doctors know if they plan to become pregnant. Poor control of their blood sugars may cause complications such as birth defects. Planning ahead, even before conception, to control blood sugar levels can lower the risk of miscarriage and birth defects. During pregnancy, it is important to test blood glucose often and keep your A1C below 7%. Good blood sugar control can reduce other complications during pregnancy such as high blood pressure or retinal damage in the mother. Preeclampsia is a condition that 18% to 30% of pregnant women with diabetes develop. Preeclampsia develops after the 20-week mark and is characterized by high blood pressure and proteins in the urine. It is important to treat preeclampsia. If untreated, it may harm the baby and put the mother at risk for stroke and seizures. Once the baby is born and if the mother is breastfeeding, it is important for her to check her glucose levels frequently. Juvenile diabetes. A father checking his child's blood sugar. In the United States, 13,000 children are diagnosed with type 1 diabetes each year. Diagnosis of diabetes in children is a life-changing situation because it affects the whole family. Parents must help children monitor blood sugar and plan family meals that are appropriate for the child with diabetes and other family members. Insulin dosages must be monitored and blood sugar levels need to be checked by the child's caregivers. Diabetes in children is a 24-hour-a-day problem that needs to be considered when a child is attending school and participating in extracurricular activities. Parents and their children need to make arrangements to follow through with insulin treatments even while the child is at school. These arrangements need to be planned in advance, as not every state or school may participate in the child's care the same way. Type 1 diabetes treatment. Artificial pancreas. Researchers are attempting to develop an artificial pancreas. This device is a combination of an insulin pump and continuous glucose monitoring system controlled by a computer program. The goal for the system is to release insulin in response to blood sugar levels and to reduce the release of insulin if blood sugar levels drop. The goal is to have a device that mimics the function of a normal pancreas. Some early trials of experimental devices suggest this device may be available in the future.